Amy, we've known each other for a long time, and I was just saying, you look so young still, but I've known you for maybe almost 2 decades. It's getting close to.
Yeah.
We first met when you were how old?
I was 19 when we first met.
Right. And somehow or other, even though you should have been terrified, you didn't look terrified. You looked in control as a 19-year-old.
Yeah.
Do you remember what that was like?
Well, I remember, I think I was just going through processes at that time because I had been through chemo and I had relapsed, and then the nurse had brought to my attention this procedure that I could do before I got my bone stem cell transplant. And I remember I was just going through the motions. I'm like, so I think that part of me was just like not even thinking about the greater impact this could have later in my life,
Yeah. So you were, but I mean, you had Hodgkin's disease that recurred. It was but one of the worst cases of Hodgkin's disease a person can get. But you didn't seem scared, was it?
Yeah, I think.
Were you hiding it?
Probably a little bit. I was hiding it, and some of it is just because I had been dealing with it. By the time I met you, I'd been dealing with it for 8-9 months. So you just kind of, in order to get through it, you just have to be strong, and you have to have your family and everyone next to you to help you through it.
So you just have to be strong, and that's what you're doing before, and you were dealing with it.
Yeah.
And then you faced the issue that they told you with a bone marrow transplant, you're going to be sterile, not be able to have children.
Correct.
And how did you deal with that?
I think I was really focused on school at that time. And then when they told me that, then it was like, I had to think about not only the here and now, but I had to think about my future.
Right.
And so when they said that this opportunity was out there, I thought, well, might as well give it a shot if there's a 99% chance that I won't be able to have my own children. And we come from large families, so it's very important that, I had kids later in life. I just always assumed it was, a given.
You're from Washington, Missouri, where...
St. Genevieve,
St.
Missouri.
Genevieve, St. Genevieve, where everybody has huge families.
Yeah, my mom was one of 10, my dad was one of 15. So we had large families, large farming communities. And so I think that when the opportunity arose, I was like, definitely. I mean, even if it was real experimental at the time, it was still better than nothing at all.
And it was experimental. All we could tell you is it worked in sheep.
Right, right.
And we didn't even know then that Hodgkin's disease doesn't go to the ovaries, so we weren't really sure if we could even transplant it back at that time. But we did it, but that's funny is you just don't look any older. What is your diet? I mean, you don't look any older than when I first met you at 19. I mean, doesn't she look 19? You're 33 now.
Oh, I like that compliment. A little bit wiser, though, now than I was at 19.
But it sucks getting older, doesn't it? Because getting out of bed is a little harder every morning.
Yeah. Yep.
So what you wound up doing after you were cured is you became an oncology nurse.
Mm-hmm. Yes.
And in pediatrics?
In pediatrics, yes.
So you're dealing with this every day?
Every day. Mm-hmm.
How does that feel?
It's good. I mean, I think that I have a close connection with our patients and the patient's moms. Because when you treat a pediatric cancer patient, you don't just treat the patient, you treat the entire family.
Yeah, right.
And so I think that it's helped me just understand what all of them are going through and the worries that they have. Because it's not really the patients that worry about later in life issues, the late effects issues, it's the parents. So then now going through this, at least I have the opportunity to kind of tell them about some things that are out there that, for the most part, no one knows about.
It must help because you've gone through it.
Yeah.
And it must help them to see that you're doing
surviving
so well, have a child, going for another child.
Yeah, yeah.
Okay, great. And what was it like for you? I'm just curious. Many women, you weren't a woman, you were a girl. You were a 19-year-old girl. I don't want to be PC. When you're 19 years old, you're a girl, you're not a woman. But so many girls at 19 would be so terrified about their potential mortality. Did the idea that we were planning for your future kind of help give you the confidence that we had that the bone marrow transplant would work?
I think so. I was always very motivated throughout everything, and it kept me going. I always had this, what we call PMA, positive mental attitude. So it's the only thing that so the things like that helped me strive, to go through one more chemo treatment or one more radiation treatment, knowing that I could get through this,
And then the other interesting thing we talked about before is it's still in your mind that your girlfriends at 33 are they're worried about their biological clock because
Yeah.
in the modern world, they may not get married till they're 35, and then they seriously think about having kids at 38, and they're all terrified about their biological clock.
Yeah.
And you're able to tell them,
Yeah.
I don't have any problems. I've got a 19-year-old ovary.
Yeah. Exactly.
So it's one of the benefits of the cancer was
Right.
that
Right.
you have young ovary.
Yes.
All right.
Yes.
So what we're going to do this morning is put back 2 more pieces. Okay. So we have more left, obviously. 3 more pieces left after that. And, it only lasted a little more than 2 years. That's because in those days, all we had was the so-called slow freeze cryopreservation technique. And we've discovered a lot since then that it does kill, over half of the eggs. The transplant will be perfect. We won't kill any eggs with a transplant. We've really perfected that, as you know. So that's why this is working so well, because despite the loss from freezing, we'll have no loss from the surgery. And we should have another baby from this, or maybe we'll be happy we'll get 2, and then we still have more in the freezer. And they're 19-year-olds, so, with young eggs like that, you should get pregnant pretty easily. But of course, now we have this vitrification technique where there's no loss of eggs from the freezing. But we didn't, in 1997, we were just happy to be able to use this slow freeze technique. Okay. So you got pregnant from your first transplant, and any special effort, or was it just relaxed, happy,
yep.
Love making and along the way? No IVF and no drugs.
Nope.
And that's what's beautiful about this. So it should happen again for us, at least 2 more times. But if we can squeeze, I don't know how big a family you want coming from Washington, but if we can just squeeze even 2 pregnancies out of this next one, that would be nice. And then 2 out of the one after that, we'll have a big family.
That might be a bit too much for Jason.
Well, he's a modern man. In the modern world, it's not so easy to have 10 kids.
Not as young as I used to be either.
Yeah, me also. But in the old world, 10 kids is great. You put them to work on the farm, and it's no big deal. But in the modern world, you can multiply that by $100,000 for college, and it's terrifying.
Yeah. Exactly.
Well, okay. Now, we have assembled here a group of really great doctors and laboratory people from all around the world that want to learn how we do this. We've got Dr. Ruvalcaba, who has, I think, just about the best freezing ovarian and egg preservation program in all of Latin America, including South America. Trained by the Japanese. He's very good, but he wants to see how we do the transplant, if that's okay. And then we have Dr. Diaz, who comes from the greatest program in Europe, very famous program called IVI. And they know how to do the ovary freezing. They're great at freezing, but they want to learn the transplant also. So they'll watch the transplant, Dr. Ruvalcaba, Dr. Diaz. And then we got Dr. Schlenker from Colorado. That's one of the very best IVF programs everybody knows in the country, in the U.S., and he's going to learn the laboratory work, because he's a laboratory guy, how we do the freezing. And then we got this brilliant guy, Dr. Hayin from Beijing, who is going to learn the laboratory technique also. But I'll just be doing the surgery, and as you know, Kathy Lenahan, our chief embryologist, is doing the thaw of the tissue.
Okay.
So we'll do it just like we did it last time. Should be no problems.
Okay.
Once we have the tissue all quilted together, thawed and ready, then we bring you in the room and we'll do the procedure.
All right.
Any questions for us?
I don't think so.
Last time, I wanted to see her. I was so upset with her. I wanted to see her the next morning, before she goes, but she figured this should be an outpatient procedure and not an inpatient procedure. So she just walks out of the hospital before I got a chance to even...
Dr. DeRosa said I could go, so I was like, they walked the hall and I could go, and I walked the hall, so I left.
I wanted to see her, but she was ready. She felt great. So the reason I make that point, I really gave her a hard time about that.
I already asked. I'm not leaving until I see you.
Until I see you, even though you're blooded tears here. But the reason is, I mentioned that point is, this is not such a terribly difficult procedure, right? I mean, it's fairly easy for you to go through. It's not a big, enormous, like we use the word transplant. It sounds like it's a major insult to you. I mean, but you felt pretty good right away.
Yeah, I mean, I was, sore, for a good week afterwards.
Sore for a good week, but it wasn't anything terrible.
Yeah.
And then when were you able to feel more normal?
I was back at work. I think I took 2 weeks off, but I probably could have taken only like a week and a half and been back at work. But I was doing some things around the house.
Great. And then you began to menstruate and ovulate? Was it
within 5 months? Because we got the transplant in January, and I started in June, and then we were pregnant by September.
That's what we expected. It's not taking that long for the transplant to work. It's working immediately, but that's how long it takes for the primordial follicles to develop into mature follicles that reach the menstrual cycle phase of development. So, but it'll start working right away, though.
Yeah.
All right. Well, that's fantastic. You don't mind if we show this at medical meetings? And,
no, that's fine.
And we're trying to promote this, like with places like the Lance Armstrong Foundation and Fertile Hope, and try to get people more aware of this, that it's available.
Yeah.
Is that okay?
Uh-huh.
All right. Great. Thanks, Amy.
All right. Thanks.
Fantastic.